Hello, my name is Michelle Wynn. Today I will be performing the vital signs skill. Um, to begin with, I am in the appropriate uniform. I have my badge on. I have my supplies, which is a stethoscope, a blood pressure cuff, something to write with, and an alcohol pad. And of course, I have my patient. So I will begin by knocking to enter the room. I'm going to open and close the curtain. Will introduce myself. My name is Michelle, and I'll be here to take your vitals today. I will do hand hygiene. Can you please tell me your name and your birthday, please?
My name is Makai Thomas, and my birthday is September 21st, 2005.
Thank you. I will check his wristband to ensure that I'm with the right patient. Okay, so I will begin by taking your pulse or assessing your heart rate. So I'm going to do this in the radial area. Sorry, relax. Okay. Okay. So I got 34. Okay. And since his heartbeat is regular, I only assessed it for 30 seconds and I will multiply that times two. So I got 34. So that would be 68. And that is within normal range. The normal range is anywhere between 60 to 100 beats per minute. Okay. Now I'm going to check your respirations. Okay. And this is similar to when checking heart rate. If it's normal, I can do it for 30 seconds versus the full minute, and then I will multiply that times two. So his respirations is at six. So six times two is 12. And that is also within normal range. Normal range is anywhere between 12 and 20. If I can just have you sit up for a second. Okay, and his depth of breath is regular as well. So next I will proceed with taking your blood pressure. So when taking blood pressure, I have to locate his brachial nerve. Sorry, his brachial artery. You can just relax and make sure no legs are crossed or anything. And also, have you worked out or drank any coffee within the last 30 minutes?
No.
Okay, either one of those could alter his blood pressure. So I just want to make sure if he had did one of those within the last 30 minutes, I would wait before assessing his blood pressure. Okay. Okay, so I have located his brachial artery. So when applying the blood pressure cuff, there's arrows on here which indicate the left arm or the right arm. I will be taking this on his left arm. So I'm going to line up this arrow with his brachial artery. And this is the appropriate blood pressure cuff. Yeah, thank you. So I'm applying it where it's not too tight, but it's snug enough. Okay, and do you know what your normal blood pressure is?
No.
Okay, since he does not know his normal blood pressure, I will use the normal range, which is 120. However, I will go up 30 millimeters for accuracy. I will clean my stethoscope, the diaphragm side, as well as the bell side. I will be using the diaphragm side. You can just relax a little. And the stethoscope should not be touching the cuff. Wait, let me bring this a little closer. Okay, and I want to make sure that my thumb is out of the way so I'm not getting a false reading based on my pulse. Okay, so I did get a reading of 105/78. That is within normal range. The normal range is anywhere from 90 to 120 for the systolic, and for the diastolic, it's anywhere from 60 to 90. Excuse me, 60 to 80. Gonna do hand hygiene again. Okay, you can get comfortable. Do you need anything?
No.
Okay, so I'm gonna go and put your readings in your chart. Okay, I'm gonna open the curtain and close the door behind me.